Hey there, welcome to The Explainer. So today we're looking at a genuinely fascinating problem. Imagine trying to replicate the level of care you'd get at your local hospital, but your entire country is completely scattered across the middle of the ocean. Think places like the Maldives. It's just a massive, mind-boggling logistical challenge, right? Well, today we're going to explore a really innovative blueprint that tries to solve exactly that. Seriously, how do you deliver world-class healthcare across literally 1,000 miles of ocean? Because that's the massive logistical nightmare this policy is tackling. You're dealing with vast, highly dispersed island communities. I mean, you can't exactly just build a massive superhighway to connect everyone to some central mega hospital, can you? You actually have to figure out how to ensure that a person living on a super remote atoll gets the exact same equitable access to primary and emergency care as someone living right in the middle of a densely populated capital. And the structural constraints here are intense. We're talking about extreme physical distance and deeply fragmented populations. Then, add in the sheer difficulty of getting specialized doctors to live permanently on tiny, isolated islands. Oh, and don't forget the ever-present looming threat of climate change. When you put all that together, you quickly realize these aren't just minor speed bumps. These are core existential problems that demand a completely outside-the-box approach to public health. Okay, let's dive right into our roadmap for this explainer. First, we'll look at the Island Healthcare Challenge. Second, the hub and spoke strategy. Third, digital health and telemedicine. Fourth, financing a resilient system. And finally, climate-proofing island healthcare. All right, moving into part one, the Island Healthcare Challenge and its core objectives. So looking at the big picture, the overarching goal here is universal access. They want everyone to have essential care, completely regardless of which island they happen to live on. That means they need to build up a resilient, continuously trained workforce, secure some solid long-term funding, and really go on the offensive against non-communicable diseases, or NCDs, along with mental health issues. And naturally, because of where they are, making this entire system incredibly resilient to climate threats has to be baked right into the foundation from day one. Let's move to Section 2, the hub and spoke strategy, and how they actually structure this care. So, instead of treating every single island like its own isolated little bubble, imagine a giant bicycle wheel. In this model, the regional hospitals act as the central hubs. They provide the specialized care and heavy-duty diagnostics. Then, the individual island health centers function as the spokes. What's really brilliant about this is that it creates a tangible, reliable lifeline. It seamlessly connects even the absolute most remote islands straight back into a powerful, centralized network of medical resources. And this naturally builds into a very clear, logical chain of care. Step one is your local island health center. This is the primary entry point for all non-emergency stuff, making sure every inhabited island has a guaranteed essential service package. Now, for step two, if you need more complex care, standardized protocols kick in and refer you up to the Atoll Regional Hospital. That's your secondary hub for specialist clinics and emergency stabilization. And finally, step three scales all the way up to the national authorities for that top-tier, highly specialized tertiary care. On to Section 3, digital health and telemedicine, which is all about bridging that massive physical gap. Look at the stark contrast we're dealing with here. On one side, you have these massive traditional barriers, island isolation, really slow boat travel, and just the sheer physical distance between a patient and a specialist. But on the flip side, you have these new, mandatory digital solutions. We're talking telepsychiatry for complex mental health cases, totally unified electronic health records, and remote diagnostics. Basically, it effectively beams the doctor straight out of the regional hub and directly into that local health center. It is literally a game changer for equity of care. But, of course, you can't just casually digitize an entire nation's health data without some serious safeguards in place. This whole digital leap relies entirely on rigorous, unified national data governance. They enforce super strict regulations around data privacy, cybersecurity, and interoperability standards. The ultimate goal here is to absolutely guarantee that when a doctor on a remote island pulls up an electronic health record, that data is perfectly synced and, most importantly, completely secure across that entire hub-and-spoke network. That brings us to Section 4, financing a resilient system, paying for the future. So, the obvious question, how does a scattered island nation actually pay for all of this? Well, check out this brilliant approach. They use earmarked health taxes, often called sin taxes, on things like tobacco, sugary drinks, and alcohol. It creates this highly efficient, self-sustaining financial loop. The funds from these taxes are channeled directly back into financing primary healthcare, which in turn actively prevents the exact same non-communicable diseases that those products help cause in the first place. Pretty smart, right? But hey, sustainable financing isn't just about the dollars and cents. It's about the people. I mean, how do you actually convince medical staff to pack up and stay on remote islands long term? You have to heavily invest in them. They use task-sharing models to optimize the skill mix so the clinics actually run smoothly without burning people out. They offer continuous e-learning and telementoring to keep doctors sharp. Plus, they roll out crucial retention strategies, things like structured rotations, dedicated housing support, and targeted recruitment straight from those outer islands to guarantee a reliable, long-term local talent pipeline. All right, our final stop is Section 5, Climate-Proofing Island Healthcare, the Existential Threat. When it comes to climate threats, the physical requirements for this system are absolutely non-negotiable. Every single health facility literally must adopt climate-resilient design standards. They have to have rock-solid backup power and water supplies. They are required to maintain incredibly secure cold chain systems because you really don't want vital medications or vaccines spoiling during a massive storm. And on top of all that, every facility runs annual business continuity plan drills to ensure they are genuinely, practically ready for the worst-case scenario. And take a look at this specific mandate from the policy. It says national emergency medical transport protocols shall be established with the Coast Guard, aviation, and private operators. This really highlights something crucial. Surviving a major disaster or a medical emergency across 1,000 miles of ocean, that's not just a healthcare department issue anymore. It becomes this massive whole-of-society coordination effort. But long-term resilience also relies heavily on the people themselves. That's why island health committees are set up to provide structured formal feedback on things like service quality, access barriers, and local cultural considerations. This is so important because it ensures the system isn't just some rigid top-down mandate from the capital. It becomes a deeply culturally grounded service that actually listens to the local islanders, addressing their needs in their own context. Now, to ensure this massive machine actually runs, there's a very clear governance hierarchy mapping exactly who is accountable for what. At the top, the national authorities handle the big picture: policy formulation, overarching regulation, and that tertiary care. Moving down, the atoll authorities basically act as the middle managers, coordinating service delivery and emergency response across their regional hubs. And finally, at the most granular level, the island councils are right there on the ground, supporting the day-to-day primary healthcare operations and keeping the community engaged. Crucially, though, these island nations aren't doing this in a vacuum. They don't act alone. They set up formal agreements for shared specialist services and cross-border referrals with other countries. They tap into regional training networks like tele-echo programs to build up their capacity. And maybe most importantly, they join forces. They use their collective voice alongside other small island developing states to advocate on the global stage for vital climate health financing and fair medicine pricing. Which really leaves us with this final profound thought. These island nations are dealing with extreme physical isolation, limited resources, and the absolute frontline impacts of a rapidly changing climate. Yet, through these innovative hub-and-spoke models, aggressive digital health integration, and incredibly strategic financing, they are building something remarkably resilient. So, as climate threats grow globally and start challenging infrastructure everywhere else, we have to ask, is their survival strategy essentially a preview of global adaptation? Are these island nations actually writing the blueprint that the rest of the world will eventually need to follow? It is definitely a fascinating question to consider. Thanks so much for joining me on this explainer, and keep questioning how the world works.